Hey, welcome to the Memorizing Pharmacology podcast. We are going to go into part 2 of antimicrobials, and I just wanted to let you know where you can find these recordings besides on the podcast. If you want to kind of go through all of them and really kind of take a deep dive into pharmacology. We're here at memorizingpharm.com/OER, and obviously we're making some progress here. So Chapter 1, Kinetics and Dynamics, Chapter 2, Legal Ethical, and we'll be done with Chapter 3, Antimicrobials, doing the cases and critical thinking, and then we'll go back and read the entire book. So let's start with the first case, 3.11. We are in the macrolide chapter. So a macrolide, you can tell the ending, be careful, it's not just mycin, M-Y-C-I-N, but T-H-R-O, M-Y-C-I-N, erythromycin, azithromycin, clarithromycin, which isn't listed here, is also one if you want to think about the endings. So again, I'm Tony Guerra, pharmacology professor at Des Moines Area Community College. All right, well, here's our case, critical thinking, activity 3.11a. A nurse is administering azithromycin to a patient with an acute bacterial worsening of COPD. And we always want to identify any acronyms. So if we don't know that stands for chronic obstructive pulmonary disease, which is a bit different than asthma, make sure to look it up. Today, the patient's sclera appear yellow, which is a new finding. What is the nurse's next best response? And what we're really seeing here is there's some evidence of some kind of liver issue. And so, of course, we want to notify the prescriber. Other things that can happen, you can have hepatic necrosis, hepatic failure, cholestatic jaundice, hepatitis, abnormal liver functions. But again, what you're going to see is when you see a medication and you see some kind of indication, likely we're going to have some kind of adverse effect. Okay, 3.12 is the aminoglycosides. Our case is a patient admitted with streptococcal endocarditis. The nurse is preparing the morning dose of streptomycin. The lab has not yet arrived to obtain a trough level. The drug is now overdue to be given. What is the nurse's next best response? In this case, we really do want to have that trough level. We really want the make sure to get that lab, and there's nothing wrong with calling down to the lab and saying, hey, we're a little bit overdue here for the medication. What is it that we can do to maybe make sure that we get this so that the patient can get their medication, or contact the prescriber to make that call if maybe there's some pushback from them. Chapter 3.13, tetracyclines. This one is a classic. When you are looking at something like this, these are one of the classic adverse effects that comes along with an antibiotic. So the nurse is providing medication teaching to a parent of a 6-year-old child with strep throat in a clinic setting. Due to multiple drug allergies, tetracycline was prescribed by a doctor who is new to the clinic. What is the nurse's best response and why? And so we see a child, we see an age, and immediately we're looking at what's going to be the issue. And you might be able to see it here in the table, but we want to avoid using tetracyclines in children younger than age 8 because it can cause that permanent discoloration of the teeth, some enamel defects, bone growth retardation. So, how do you know something is a tetracycline though? So again, this is one of the drugs that has that stem, CYCLINES. Okay? And I might just go back to aminoglycosides for a second here. Sometimes there's a thinking that, and kind of why I wanted to mention that mycin is not enough. If you look at the macrolides, you saw erythromycin, azithromycin. Well, these have mycin on the end. So do aminoglycosides. One's spelled M-I-C-I-N, one is M-Y-C-I-N. What does mycin even mean? It just means the antibiotic came from the Streptomyces class of bacteria, and it doesn't really tell you that it's in a certain class. It kind of hints at a couple of classes, but in this case, it isn't definitive. Tetracycline, however, ending with the cyclines, that is sure to be a tetracycline. Again, the tetra meaning four, so 4 rings from organic chemistry. Okay. But yeah, do make sure to get the prefixes and suffixes down, whether from the book or the resources, because having those makes it so much easier to identify the antimicrobial. Okay, let's go on to 3.14, antivirals. A patient's prescribed also Tamiflu for influenza symptoms. Patient states to the nurse, "Oh, I hope this medication works quickly. I felt lousy for the past 5 days." Oh, geez. What's the nurse's next best response? Well, also Tamiflu is only going to be good if you took it in the first day or two, which is 24 to 48 hours. And it sounds like they're outside of that window. So now it's really going to be letting the prescriber know, the patient has had this for 5 days. Don't really think that it's going to be effective. What's our next best step? Okay. All right. Let's go to 3.15, antifungals. Patient is in a skilled nursing facility. He's been receiving nystatin applied to groin folds twice daily for several weeks, but there is no sign of improvement. What is the nurse's best response? Well, anytime you don't have improvement from a therapy, you want to contact the prescriber, let them know it's not working. What's an alternative that maybe we could use? And the same thing with the antifungals. I'll pull some of the stems here to help you out with that. The reason I wanted to pull this up is that sometimes there's confusion about what makes the correct ending for an antifungal or another medication. In this case, if we had fluconazole or ketoconazole, those endings are pretty well established. Okay. However, nystatin, which is what we're using here, this is not, because nystatin's old. I mean, we've been using it forever. And there's a drug that is very similar, that is a cholesterol-lowering medication, that has a vastatin stem. So sometimes we need to be careful, because we'll say, okay, well, the patient has a statin. All right, but you see nystatin. Well, that's not what they're talking about. So let's go to the cardio section. And we can see that the HMG-CoA reductase inhibitors, atorvastatin, lovastatin, pravastatin, rosuvastatin, and simvastatin, all have that statin ending, but it's really vastatin. So be careful with that one. That's one that can get a little bit confusing, but we're looking today at antifungals, and nystatin is an antifungal, but anything with vastatin is going to be for cholesterol lowering. Again, this is the Memorizing Pharmacology, a Relaxed Approach book. All right, so let's go back to our next case. Critical thinking activity, 3.16a. This is an antimalarial, and here is the case. A nurse is providing medication teaching to a patient who is planning on visiting a country with high rates of malaria to do mission work. The patient states, "I'm glad I only have to take this medication for a week. The side effects sound horrific." What is the nurse's best response regarding the length of therapy? Yeah, when you're talking about antimalarials, you're probably talking about a month, just even after leaving that area. So when you talk about, okay, you're going to go there for a week, you're also going to need to continue to take that medication for probably 4 weeks after leaving that area. So I want to make sure that the patient knows, hey, this is going to be a little bit more long-term than maybe you thought. It's a little bit disappointing, but your mission work is important, and we want to make sure that you take the medication in such a way that you don't get malaria, which is absolutely horrible to get. Let's see. So critical thinking activity 3.17a, antiprotozoals. A patient develops C. diff after taking multiple antibiotics for a non-healing wound. What medication is commonly used to treat C. diff, and what route is used? Really, metronidazole or metronidazole, different pronunciations, is one of the drugs we see quite a bit, and definitely would be given PO in this case, since it's just the easiest route to give something like this. But the big one that you're going to watch out for with contraindications is this use of alcohol or disulfiram. Disulfiram is meant to help someone who has alcoholism to stop using it. What it does is it makes them very sick. It's called a disulfiram-like reaction. And when you have metronidazole, the same thing will happen. So if the patient takes alcohol with an antibiotic, metronidazole, then that would make them quite sick to the point of vomiting and so forth. Not that you really should be taking any kind of alcohol when you're taking antimicrobials, but it is what it is. Okay, let's move on to 3.18. 3.18a, a mother reports that her 4-year-old son has a worm in his stool this morning. They live on a dairy farm. She reports that her son enjoys being in the barn during chore time. It's common for the livestock to develop worms. Mebendazole was prescribed. What patient teaching should the nurse provide to the child and the mother? Okay, so let's just start with what we should be telling the patient. You want to prevent reinfection for sure, and so really making sure that they're washing their hands, washing fruits and vegetables, wearing shoes, so that kids don't always wear shoes, especially when they're kind of just playing around with things. But there's going to be feces in that barn, and what we want to do is we want to make sure that we stay away from it. So again, an antihelmintic like mebendazole is something that we really can use very well just to eliminate the worms, but prevention is another part of it. I do want to talk a little bit about that ending, though, when you talk about antihelmintics. Let's just start with what an azole is. It's a 5-membered heterocyclic compound with a nitrogen atom. So it's just talking about this organic chemistry. I don't want to call it a substance. I guess it's more of just a molecule, but it's a ring, and that's what the azole is. And a lot of times we see those kind of flashcards, note cards saying an azole is this or an azole is that. If you're going to look at the stems, the stem for, we just talked about the antifungal is conazole, okay? But when you're talking about something that is for GI, it's going to be prazole. Okay, so prazole as in Dex, lansoprazole, Dexilant, esomeprazole, Nexium, omeprazole, Prilosec, lansoprazole, Prevacid, pantoprazole, Protonix, rabeprazole, Acifex. That's the proton pump inhibitors for too much acid. There's another group that has the azole in it, which is piprazole, as in Abilify, so aripiprazole, and I'll take you to the prior page here for schizophrenia. It's a 2nd-generation antipsychotic. So we really want to be careful when we're using those endings and make sure that you're studying, I've taken these from the United States Adopted Names Council. These are where the endings are supposed to come from. Don't take them from electronic note cards from someone that you don't know what they got as a grade in pharmacology class. But back to the whole point of this, just showing that mebendazole is going to have its own end. And that ending is bendazole. So it's an antihelmintic. And so using azole will confuse them. But from the book, it's prazole for the proton pump inhibitor, bendazole for the antihelmintic, conazole for the antifungal, and then piprazole for the antipsychotic. Okay. All right, let's go back to our next one, which is critical thinking activity 3.19a. Patient has been prescribed isoniazid as part of a multi-drug regimen for resistant TB. Direct observed therapy has been initiated. Patient asks the nurse, what does direct observed therapy mean? Well, it just means that we're going to supervise all those doses because it takes so long to go through the course for TB, sometimes 6 months, sometimes a year, and we want to make sure that resistance doesn't develop. So after that, we'll want to see, are there any barriers in making it here and so forth to make sure that they're able to take their medication. But immediately, you should know that isoniazid is for TB, and that's because it's in the ripe mnemonic. And this is from the book Memorizing Pharmacology Mnemonics. So memorizing pharmacology is just the stems. Memorizing pharmacology mnemonics, that's the one where you're kind of taking the next step. So if you're going to be like nurse practitioner, physician, physician assistant, pharmacist, and so forth. And the riper mnemonic is rifampin, isoniazid, pyrazinamide, ethambutol, rifabutin, and thinking how when you have that induration, it looks kind of ripe when you get the positive TB test. But that's how you know where isoniazid sits in the tuberculosis landscape. Okay, and we're going to see kind of a theme here. We've seen something like this before, but 320, miscellaneous antibacterials, glycopeptides. Nurse is caring for a patient who is prescribed vancomycin IV for a MRSA infection, methicillin-resistant Staph aureus. The dose of medication is due now, but a trough level is not available yet in the chart. That's the nurse's best response. Again, we saw something like that. We really don't want to administer vanc until that trough is drawn. And so again, calling down to the lab, seeing if the prescriber can hurry things along, however you want to do it. But again, be careful. This mycin ending is a little bit tricky. Vancomycin is a glycopeptide antibiotic, and we saw already that many different antibiotic classes have some kind of mycin in them. We saw that azithromycin and erythromycin were macrolide antibiotics, and we saw that streptomycin, gentamicin are aminoglycosides. So if you see mycin, great. It probably tells you it's some kind of antimicrobial, but don't go further than that. You really want to kind of memorize, all right, well, of those antimicrobial classes, which ones are probably going to end in mycin or thromycin and so forth. Okay. All right, well, that concludes our Nursing Pharmacology, Chapter 3, Antimicrobial Cases and Critical Thinking. So we're going to go on to the next chapter soon, and that's going to be Chapter 4, and it's going to be the autonomic nervous system. Right, so that's coming up next. Again, if you want to contact me, TonyThePharmacist@gmail.com. If you want to hear all of the episodes, you can either go to memorizing.libsyn.com or wherever you get your podcasts, or I've made this memorizingpharm.com/OER webpage where you can, let's refresh it. Yep, there we go. No longer coming soon. It's here. So Chapter 1, Kinetics and Dynamics, Chapter 2, Legal and Ethical, Chapter 3, Antimicrobial in the books, and then we will get to the autonomic nervous system next.